All right, let's go to my next case is Janice. Janice is a seven-year-old girl born at 37 weeks gestation with low birth weight. Janice is brought to a child psychiatry clinic by parents with complaints of immature behavior, not getting along with family members, teachers, or peers. During extensive interview, the following problems are identified. Janice has trouble approaching peers appropriately. She often disrupts their conversations and activities and is then rejected. She wants to engage but seems not to know how. She avoids eye contact and rarely smiles at people she's interacting with. She sometimes plays with younger children by running around and touching them. Sometimes the children's parents complain that Janice is too rough. Also in class, she will often not ask to get out of her seat, but will move around the class or even walk down the halls. Janice is in first grade. She only sometimes follows instructions and does the assignments in class the other children are doing. She'll sometimes sit and draw or write the alphabet, which she knows how to do, but does it individually and not in keeping with the classroom task at hand. Janice's teacher, as well as her kindergarten teacher earlier, advised the parents to have Janice evaluated. Teachers also noted that Janice's speech articulation is impaired, leading to lower intelligibility of her speech. Okay. Given this information, which diagnoses are most likely on your differential diagnostic list? ADHD, autism spectrum disorder, conduct disorder, disruptive mood dysregulation disorder, and/or social communication disorder, also called pragmatic communication disorder. And the three are going to be ADHD, ASD, and social communication disorder. There's really not much evidence of conduct disorder. She sometimes is playing rough with kids, but it sounds like she just doesn't know how to play. She has limited kind of social interactional skills and awareness. And there's really, again, with DMDD, temper tantrums and ongoing chronic irritability, not really anything there to suggest that. Could it be there? Anything could be there. But we're going to go with the stuff where there's at least some positive evidence for that. As part of Janice's workup, which of the following medical tests are most important to order? Audiology, FMR1 gene, head CT with contrast, dexamethasone stress test, or serum lead level? Well, this is pretty easy, isn't it? Audiology, FMR1 gene, serum lead level. So she certainly seems like she could have autism spectrum disorder, and we'll get into that. And when you have that, and she might also have like some learning problems, right? Speech problems. We need audiology. So kids with any suspicion of developmental delay, autism spectrum, intellectual disability, should all get tested for audiology. The FMR1 gene to test for Fragile X syndrome, and then get a serum lead level. Head CT with contrast dexamethasone stress tests are just not even kind of close. Which of the following are usual symptoms of social communication disorder? Whoa, what is social communication disorder? Let's look. Deficits in understanding and use of gestures, distractibility, extreme distress at small changes, preoccupation with unusual objects or interests, or reduced sharing of interests, emotions, or affect. There are going to be deficits in understanding and use of gestures, reduced sharing of interests, emotions, or affect. So what is C and D? Well, that's from the other half of ASD, all right? The repetitive, restricted behaviors category. Which of the following are most likely consultations you will order in your evaluation of this patient? Neuropsychological testing, occupational therapy assessment, school readiness assessment, speech therapy assessment. Again, this one is pretty easy. Neuropsychological testing, of course. What are we going to get? Hold on, I don't want to answer that because that might be coming up. And then speech therapy, right? She has impaired speech articulation. Yes, and 5, this is like what on neuropsychological testing will be most important. So on neuropsychological testing, which types of evaluation will be most important to complete? Achievement testing, adaptive function testing, concept formation and reasoning, IQ testing, or projective testing. Okay? Well, one thing to kind of just remember for the exam is you always want to combine IQ testing and achievement testing. So achievement testing is really like what has the patient learned in school, right? Reading, writing, arithmetic, right? Kind of like that's the foundation. There's a lot of tests that test achievement. Almost all of them, I think, I don't know if all of them, but most of them have the word achievement right in it. So again, school achievement. Now, and then IQ testing. Now those two go together because let's say, usually you're getting achievement testing when the kid is not performing well in school. But just because the kid is not getting good grades or even doing very poorly on tests, that does not mean necessarily that their achievement testing scores are going to be low. They may have learned this stuff, but for whatever reason, including lack of interest, lack of motivation, just complete kind of like lack of wanting to perform, or oppositional defiant behavior, they may know a lot, but they may just not perform on tests because it's just not what they're into. So there could be a gap between school performance and achievement test scores, right? And then there could be another, it's very important also to look at the relationship then between achievement test scores and IQ tests. So let's say a kid has poor grades, but they have, and then they have poor achievement test scores too. So their tests, their schoolwork really reflects, their poor schoolwork really reflects poor achievement. But then you'd get an IQ test and maybe they have a normal or even high IQ. So then the gap is between their native intellectual abilities and what they've learned, right? So you can have a gap between those two. So you can have poor school performance with good achievement, and it's a gap in kind of motivation or desire to do one's best. Or then you can have a gap between IQ and achievement. Someone could have great native abilities, but then is not learning. And then that's meaningful. Why does that occur? And then that's the next question. Well, kids may be intelligent but not learning because they're anxious, because they're hungry, because they're being abused at home, because they're being bullied, because they're in a deep depression, or because they have ADHD and they're not attentive. So, and then the last one is adaptive function testing. So this is like, okay, based on the IQ and the achievement, school performance, how adaptive is the patient? Are they kind of reaching age norms in terms of their ability to function at home and school and in their peer environments?